Well, when the pandemic first emerged, the demand for personal protective equipment exceeded the supply. Then we saw companies like Battelle start sterilizing N95 masks so they could be reused. And then medical providers were filling the gap with donations from major corporations. Well, now we're seeing trouble pop up again. Here's consumer investigator Danielle Serino.
I want you to give us the equipment we need.
Remember those pleas back in April?
We're still getting infected. We're still passing the virus to our patients.
Well, here we are again. With the recent surge in coronavirus cases, frontline workers are once again in harm's way.
We're still in a position where we're on our knees begging for PPE. And if we had enough, we wouldn't have grannies stitching up our masks.
Fire and EMS as a whole just really hasn't been prioritized based off their importance.
Brian Leduc from Boundary Medical in Dublin, Ohio, is the largest distributor of PPE equipment to EMS workers. He says while it's easier for large hospitals to get what they need, smaller providers are low on the totem pole, especially when it comes to help from the government.
Their biggest priority they have put towards private and public hospitals. The second priority is VA hospitals. The third priority is long-term care facilities. And the fourth priority is EMS. And being at the end of the prioritization has really left them underallocated and really at risk to this crisis.
I would say it's pretty dire.
At Ohio Ambulance, they say it's not just hurting staff, but patients as well.
There's a huge need in the community to transport patients to their routine appointments that they do rely on for life-saving treatment. And a lot of them have been struggling to find transportation for the simple fact that without the PPE, we can't do it.
Part of the problem is because the smaller providers haven't needed this volume of equipment in the past, which they now also give to patients. And with many of the supplies coming from overseas, it's harder to get anything.
At this time, we have to be super vigilant about a patient showing any symptom that could be related to COVID. So unless they've had 2 negative tests recently, we have to wear full PPE.
Companies have been working with legislators to get what they need, but that's not been easy.
If a handful of teams start going down, you really put the whole system at jeopardy. And so protecting that group of people really needs to be prioritized.
Danielle Serino, 3 News.